and
Okay.
go home once he recovers.
Okay. When he stays here, do you recommend do I stay or somewhere around here, or is there?
No, you don't need to.
Okay.
So we are gonna get everything done.
They'll be all
and then
taken
he's
care
gonna
of.
basically he's gonna stay on Monday and Tuesday and go
Okay.
for surgery on Wednesday.
Okay. Okay. And then I mean, do people normally they come today? Are they with him for the whole process, or do they?
No, they don't.
Okay.
Yeah, I mean, they cannot be in the surgery. They
Okay.
they cannot
Okay.
be around. So
Okay.
yeah, what's the point of there just being worried and then he's staying here? So
Okay.
yeah, so
we basically just drop him off Monday,
exactly.
and then we come back when he's ready to be picked up.
Yeah, exactly.
Okay.
So probably it's really
And
up to
you
you.
promise to take care of him.
Oh, absolutely.
Would you actually do the surgery?
No, I'm not the surgeon.
Okay.
You don't
Okay.
want me to do surgery.
Okay.
Actual surgeon. Actually, it's your choice whether
Okay.
you would like to sit down with the surgeon on
Yeah.
Tuesday,
Yeah.
or they can give you a call and then do the phone consultation,
Okay.
and then discuss about all the possible complication and then
Okay.
surgery approach and things like that. And if
Okay.
you agree, then you can just. Just approve to do the surgery, and then
Okay.
he's gonna stay here overnight on
Okay.
Tuesday and go for a surgery the following day.
And then what are the percentage of complications during surgery that he wouldn't survive surgery? Is that?
He's a relatively healthy guy, and then amputation is most common procedure here.
Okay.
So the risk is still there,
Yeah.
but it's not really high. I mean, at least safer than doing amputation somewhere else.
Okay.
Yeah, because they are the most trained surgeon
Okay.
around this area.
Okay.
And amputation is one of the most common procedures.
Okay. Okay.
Yeah.
Do you still think it's beneficial to check with my local vet to see if they can do the bone biopsy, or?
If
would
you're
you
gonna come back
recommend-
on Monday, I mean, it doesn't change that much because
Okay.
our aiming is doing the amputation on Tuesday. I bet the result is not gonna come
Okay.
back on Tuesday. So.
Okay. Okay. So we dropping off Monday.
Yeah.
You know, amputation on Tuesday or Wednesday, probably depending on the schedule. I'm
Yeah.
assuming.
So-
And then, we would come visit them maybe after that or on Friday or something like that.
On probably you can come and visit on Wednesday, so Thursday is fine.
Thursday?
And
Okay.
hopefully he can go home sometime Friday or Saturday.
Okay.
Yeah.
Well, that sounds like a good schedule then. And, for my wife and everything, kids, is he gonna look pretty, is it gonna be tough to look at, the scars and stuff, afterwards? Do I wanna put like a t-shirt on him, or?
Yeah, absolutely.
Okay.
Either he has to wear the e-collar or the t-shirts. Yeah,
Okay.
those things fine.
And then typical recovery time where it's kind of back to normal activities, is that around 3 weeks from what I read, or is that false?
Yeah, 2 to 3 weeks is pretty good.
Yeah.
For him, it might take a little bit longer because he has been using all 4 limbs pretty well.
Yeah.
So a lot of times when patients comes in the hospital, they are
Yeah.
already limping. They are not wearing bearing weight on their limb.
Yeah.
In that case, they are very used to walk on the 3 legs.
Okay.
So for them, it's a much quicker for them to recover
Sure.
because they have been using only 3 legs already. So
Okay.
for him, he has been using 4 legs pretty well.
Okay.
So yeah, it's gonna be it might take a little long, like a month or so.
Okay.
But after that, they
do pretty well.
Yeah.
Okay. And then, just if you could kind of break down the schedule, so we do that, when would we come back for the first chemo treatment?
2 weeks after the
You do
amputation.
you do every 2 weeks, or do you take a month off?
Usually every 3 weeks.
Okay.
Yeah, so every 3 weeks for 4 doses.
Okay.
And then after that, he's gonna come back in 3 weeks after the last chemotherapy, and we are gonna start the listeria.
Okay, and then the listeria, how is that? What exactly is that? How does it, is that a drug or what?
That's the IV too. We
It's
are
an
gonna
IV?
inject
Okay.
through the IV.
Okay.
And then he's gonna stay entire day.
Okay.
And you have an option whether you are gonna bring him home and come back on following day, or you can just leave him here.
Okay. And then if he qualifies for all that, that will basically be no charge for the listeria treatment, is that kind of?
Yeah.
And there will be some incentive for the amputation and the chemo?
Yeah, there is no benefit for the standard of care. So
Yeah.
during the amputation and the carboplatin and the
Yeah.
chemotherapy, there are not much benefit for you.
Okay.
There are a little bit, but not much.
Okay.
But after the standard of care is done,
Yeah.
all the listeria related
Okay.
the charges will be
Okay. Can you tell me approximately what all that would cost for the amputation
Yeah,
and
absolutely.
chemotherapy? Just so
Amputation,
kind of prepare for it.
absolutely. The front limb amputation usually costs around $3,000 to $4,000.
Okay.
Because he's a big dog, I assume it's going to be close to the $4,000.
Okay.
And then carboplatin, the chemotherapy usually costs around $25,000 to $30,000.
Okay.
Yeah, and that's the ballpark of the.
You say 25 to 30,000?
3,000.
Oh, okay. I was like,
2,500 to 3,000.
okay. So we're probably looking for under 10,000 for everything for sure.
Yeah.
Maybe.
Yeah. Probably.
Okay.
Yeah.
Okay.
Unless there is any complication.
Okay.
Exactly.
Okay.
Yeah, that's a lot.
But we can do that, can't we, Bear? We'll figure that out.
Okay.
Is there anything with I read something about a vaccine they're going on in Colorado State. Know anything about that? As part of a clinical trial.
Either this is a Listeria vaccine,
Okay.
or there is a preventative vaccine coming up.
Yeah.
But it's not open yet.
Okay.
And also, that's not for the patient who already has cancer.
Sure.
It's for the patient who does not have cancer.
Oh, okay.
We kind of give a vaccine just to prevent the tumor.
Big dogs and giant dogs. See.
Yeah.
Okay.
Yeah,
Gotcha.
exactly.
Do you recommend, I guess I could talk about all sides of that, but I was just, reading some people, there's cannabis, special foods, I probably want to keep his weight down a little bit after the amputation.
Absolutely, that's always
I'm
recommended.
trying to get as much information as I can today. And
Yeah, so, well, he's a pretty good body condition. He's a little bit overweight as far as I see, so losing a little bit of weight would be helpful for him. No, you are beautiful. Don't worry.
Maybe 10 pounds. Huh?
So.
I know.
You definitely have some room for losing weight,
Yeah.
but otherwise, after the amputation, some owner prefers to do rehabilitation or things like swimming and things like that.
Okay.
And it's definitely helpful, but they usually even without the rehabilitation, they are doing pretty well. So.
Okay.
Yeah, it's really owner's choice.
Okay.
Sometimes they do just rehabilitation at home as well.
Sure.
So what I usually recommend is make an appointment to rehabilitation, and then at the first visit they are giving you tons of information about the passive motion and things like that. So even if they don't pursue rehabilitation, and it's really informative for them to attend at least the first visit. So.
Okay.
Does he have any other concern regarding hind leg? You just mentioned.
No. Nope. I just.
No other medical history or anything like that.
No, he's got a kind of a bigger size lipoma in his chest, neck area. That actually we scheduled him for surgery to remove that, and then we were gonna get. I told my vet, I'm like, we gotta figure out this limp. Let's get. What's going on here? Because that was the third time we brought him in for it, and that's when he pinpointed it, and then we canceled the surgery on his chest, neck area. He's like, this is obviously quite a bit more important.
Yeah, absolutely.
So, but that's the only other thing that I know.
Sure. Okay, so.
Is there anything else that we should go over today, or are we?
I think we are good. I just need to do my physical examination, and then give you the estimate on everything, and then let's go from there.
That'd be great.
Okay, perfect. All right, if you wait in the waiting area, and we are gonna borrow him just for like 20 minutes or so, and then come right back.
Awesome. Thank you very much, guys.
No problem.
Hey, go there. You're right. Follow her. I want to hold tight.
Yeah.